When arthritis causes pain or loss of function in the hand and conventional treatments no longer work, surgery may be an option. We spoke with Dr. Stephen Lin of Methodist Hospital in Arcadia, who talks about hand conditions that may require surgery.
Arthritis is a big problem, again, especially for the hands, because we do everything with our hands, whether it be work, our avocations, hobbies, anything that we need to do and interact with the world really is the use of our hands. Arthritis, unfortunately, there's not a medical cure for this yet, but there are ways we can do to treat this. Most people think of arthritis of your hips and knees, but the hand is probably one of the most common. The distal joints of the finger, the DIP joints, and especially in women, the base of the thumb. There's many types of arthritis, but the most common that most people talk about, what we describe as osteoarthritis, just means more of a wear and tear type of process. It's not a systemic disease which affects the rest of your organs, your eyes, etc., like a rheumatoid does. You start off with, for treatment of arthritis, is the first thing is activity modification, which would mean if you're doing something that's irritating the joint, to basically find smarter ways to do what you're doing. If that, again, is the most basic. Secondarily, of course, you could try splinting, which is if your joint is putting a lot of stress, for example, the base of the thumb, there are some rigid and soft splints which you can wear while doing certain activities. Thirdly, you can try medications. Again, there are negatives to this if you're taking it too long or too high of doses that's not closely monitored. But if you have a physician that prescribes certain medications, anti-inflammatories, acetaminophen is a good medication for pain alleviation, and also some topical type of medications that can just go directly in there that doesn't affect you systemically as well. The next couple of things you can do, aside from surgery, is you could try shots, again, injections of corticosteroid with a mix of a little bit of a numbing analgesic that, if in the right position or right place, it can calm down some of the inflammation inside the joint. It doesn't cure it, it's not a cure, but it can last for a few months at a time, mainly due to an arthritic joint is worn out, but the lining of the joint is the synovium can be inflamed and irritated just by using it too much. And the shot and the medicine in there, the goal for that is to put in there medicine directly. It's a strong medicine that brings down that irritated inflammation. And ideally that can take care of some of the pain and even long-term relief. If you've exhausted all these other options, you can basically go in and decide, let's go for some surgical options. And the simplest thing is, depending what joint it is, but basically is to go in and clean the joint out. Debridement, exostosis excision, meaning taking out all the extra bone spurs and basically cleaning up that joint. Is this a cure? Maybe not, but is it going to improve some of your symptoms? Yes. The next option that you can go, which is a little bit more advanced and there's really not turning back from this, is basically either a joint replacement, which is similar to the large joints, hips and knees, a little bit different biomechanics, or basically replacing the joint with moving some tendons and tissues from your own body to reconstruct that joint. If we can, knock out the pain, that's a great goal. It doesn't matter if your joints are maybe on an x-ray, it doesn't look great, but if it doesn't slow you down, that's one goal. And the other goal is, again, to improve your quality of life and your function. And if these two are met, it doesn't matter if you have arthritis. This is just a normal occurrence, and it's nothing to too concerned about. And we deal with the symptoms as they come.